Hello, everyone. Thanks for making the time in your multiple time zones that some of you are coming in from. It's like 2 days ago for some of you, or maybe it's 2 days from now for some of you. But what an incredible job Nicole and her team have done to find people all over the place. I would encourage everyone to mute their microphones. That way, there's no background noise that will get in the way of you hearing me. Cameras on or off is totally up to you. Nicole and the team will be happy to field your questions and sort of moderate for me while I'm riffing. You can raise your hand if you have a specific question that you want to ask verbally, but you're welcome to just put it into the chat box and I'll happily answer. Nicole mentioned that we'll do a Q&A at the end. That being said, I'm very happy to take questions during the presentation. I don't really want to do a stiff talk for 40 minutes presentation here today. I'd much rather be interactive, hear from you, get questions from you. I've been talking about this topic for a long time. You're not going to mess my vibe up if you ask a question in the middle. I can bring myself back to whatever topic we were talking about. We can shift gears. We can really be here to talk about whatever it is that you want to talk about. I have a basic idea of what I'd like to talk about today, but really I want to use that as an opportunity to stimulate thoughts and ideas from you that I can speak to so that you can get a sense of the types of ways that I and we here at NUNM think about the interplay between food, mental health, and nutrition. Is everybody good with that? All right. I'm going to just do the fastest bio that I can, just because people always want to know a bit more about me. I have been teaching here at NUNM for 8 years. I teach a number of different classes, but they're all on the social science side. So I am not a science wonk. We have other people who are really into the science of biochemistry and things like that, and thank goodness for them because while I might want to talk about it for fun, I could not teach it. I have been a health and wellness coach, educator, mentor for over 20 years. And so I'm all about psychology and behavior change and coaching. And that's where my teaching is here in the program. And over the years, I have developed I guess you would call it proprietary, unique approach to working with clients with their dietary change that I call food story coaching. Sometimes I'll call it food relationship coaching. What I like to say is that it's about the how and the why of our eating and not the what. So it's about our relationship with food. How do we feel about what we're eating and not eating? What are the thoughts? What are the stories? What are the rules? What are the shoulds and shouldn'ts? The good, the bad. Does everyone follow what I'm saying? Does this make sense to everybody? So what I want to talk to you about today is a little bit about how the approach to nutrition education and helping clients make dietary change is actually having what I believe to be a negative impact on people's mental health and how food story and food relationship coaching can help us with this. One of the biggest challenges for us in our field, those of you who want to go into the nutrition field or naturopathic field, is frankly, any of the health fields, really, it doesn't really matter, is getting clients to follow our advice without it causing them to feel worse, be worse, do worse than they already are. And so nutrition is sort of a two-edged sword. Certainly nutrition can be used from a very biomechanical standpoint. You can use food to help balance out neurotransmitters and to provide a client with things that can help them with their mental health. I think everyone understands that. That's a newer field, but we're certainly seeing how, vitamin deficiencies and other things, glucose and, glucose issues, all kinds of different reasons why we can help clients with what they're eating. But what I find happens so often is that the advice that we're giving our clients and the way that we're giving advice to our clients in the field actually adds to their mental health. It adds to the difficulties and the strain that they're having because clients will often come back after the couple of weeks of being given a bunch of nutrition information and they haven't really done anything, or they've tried to do some, but they haven't been particularly successful. They haven't really been able to do very much. They're struggling with implementation. It's very common that The implementation is really hard for clients even when they understand it. So don't eat gluten, drink more water, eat more vegetables. Like these are not hard to understand concepts, but putting them into action is quite challenging for a lot of us, both for environmental reasons, personal reasons, you name it, right? Money, time, all these things. So my concern has been how many clients start to think that there's something wrong with them when they're not following this program. They're like, well, I'm lazy and I'm not willing to work hard and whatever it is that they say about themselves. And I'm like, well, that's not really what's going on here, is it necessarily? It's not that you're lazy or unmotivated or that there's something wrong with you per se, but they're feeling guilt and shame and embarrassment and judgment. They're like, what's wrong with me? You told me what to do, and I know I feel better when I eat like that, but for some reason I'm just not doing it. So you can see, I think, right away my sort of fundamental premise of how nutrition can have a negative impact on people's mental health. Does everyone follow the sort of fundamental premise that I'm after? Okay. So the biggest concern that I have with the way that we do nutrition education is that we're setting our clients up not to be successful, and that is what's leading them to feeling worse about themselves. So even if we were approaching a client directly, trying to improve their mental health through nutrition, we might actually make their mental health worse by the way we present and deliver and um, support or don't support them in making those changes. So it's very important to understand that there's two components to this. One is the way we do nutrition education, the way we do dietary change. We've got to be more realistic with our patients and our clients. We have to be careful that we're not asking them to make these massive changes in their lives that are just not realistic. Raise your hand if you've been exposed to the idea of the SMART goal setting system. Most of us have, SMART, and you can use digital hands up, of course. Almost everybody knows what the SMART goals are. Well, one of those questions is realistic. How realistic is this goal? And the problem often is that clients aren't aware that they're being unrealistic, practitioners aren't aware that they're being unrealistic. And so now we give clients an unrealistic goal, and that just makes them feel worse about themselves. Because they're like, but I should be able to achieve this goal. Well, no, actually that goal is unrealistic. So it's not reasonable to think that you should have achieved that goal. It's like, oh, well, that makes sense, right? Often it's too restrictive. It's too demanding, right? It's too heavy on data and information. And so they get overwhelmed, they get confused. And again, that leads to more feeling of frustration and overwhelm and stress and not enoughness. Any Brene Brown fans in the room? Anybody Brene Brown fans? Right? The not enoughness. Oh, what's wrong with me? I'm not good enough. I'm not smart enough. I'm not hardworking enough. Right now, we're making their mental health worse again in an attempt to help them. And this is a common trap that practitioners end up in, mainly because our industry has been set up to focus on education over empowerment. And I'll talk a little bit more about that in a minute. So again, we want to be careful that while we give people information, that we give them practical skills and information, we want to also make sure that we don't fall into the common pitfall of thinking that just knowing is going to be sufficient to creating change in their lives, and that just more information or more information is always a good thing. Often too much information causes more stress and strain because clients can only use some small percentage of it. And then everyone probably knows this phrase, they start shooting on themselves, right? Does everyone know that one? When they don't use the information that we've given them. So we say, oh, here's all this information. I'm going to give you reams and reams of data. You'll have all the information you can possibly use. They're like, yay, thank you. And then they can barely use 10% of it. And then all they do all day is say, but I should be doing this and I shouldn't be doing that. And then we're right back into the whole negativity, negative feedback loop, self-recrimination, self-blame, judgment. And that's just not helping their mental health. So even if this was a perfect nutrition plan, that would feed their brain and their gut-brain biome and give them everything they needed for the maximum mental health. They can't implement it, and now their mental health is worse. So we've got to be careful about this. So sorry, was there a question there?
I don't think so, but I do have a
okay.
question in the chat.
Okay, I'll pause.
So,
That's great. Pause me.
yeah. So this question is that this participant's at the point where losing weight would be beneficial, but maintaining a calorie deficit seems to affect their mental health
Yes.
negatively, but gaining weight does that too.
Yes.
Any
Yes.
tips? What gives?
Yeah. So this is where the work that I want to talk more about here in a minute is going to be illustrative. This is why we have to work with clients' relationships with food. Now, when I say relationship with food, I'm sort of including fitness, body image, weight, dieting. It's all very interrelated. So if we don't have a direct conversation with the patient about that challenge, my mental health is negatively impacted whether I'm trying to be on a calorie restricted diet or when I gain weight. Either way, my mental health is negatively affected. Rather than just trying to resolve it and say, but you're committed to losing weight, so let's just focus on losing weight, let's actually have a conversation about the tension that both of that exists with, but I feel negative emotionally no matter what way I go. Yes, that is fair and true and understandable. And so food relationship coaching, food story coaching, this sort of way of approaching clients in these situations is let's talk about all of it. It's a both and conversation. Yes, you feel both of those ways. Both of those ways are legitimate. Let's talk about it as in sort of an inclusive way, rather than trying to determine, but it should be one or the other. Well, you either got to pick weight loss, or you're going to have to just deal with the emotional turmoil of being on a restricted diet. No, let's talk about it enough that maybe a natural point of resolution will come up where the tension of the opposites, if you will, right? If you think of these as two opposite things, that tension can soften. So that's the short answer, and I'm happy to expand more on those concepts. But does everybody following me so far? Like, this is why nutrition and mental health and coaching and food relationship goes all together. Okay. Because food is not a purely rational component of people's lives. I mean, raise your hand if you think of yourself as a purely rational person when it comes to eating. Because if you are, I want to meet you because I need to write a book about you. Because we're going to go to the Guinness Book of World Records, and we're going to win a lot of money because you're going to be the first human ever documented who eats 100% purely rationally. And I know some of you are going to say, "Oh yeah, no, I only eat clean food, and I eat only the number of calories that I need, and I only, yeah, guess what? That's your relationship with food. That's a food story, and that's emotion. There's no such thing as eating without emotion. My joke is, unless you're an absolute psychopath, narcissist, or psychopathic, you have emotion when you eat. It's just part of being human.
There's a
And
really interesting comment in the chat that kind of goes along
please,
with this. And it's,
please.
I've noticed that changing what we eat also changes our relationship within our family or friend group. And if
Yes.
it creates separation or division, then we go back to old habits.
Yes. Yes. So you're speaking directly to the challenges of you or our clients trying to make changes in their dietary habits means that they're changing their relationship with food. Well, when they change their relationship with food, they are impacting everyone else around them. And the biggest challenge for most of the patients that I've worked with and that my students and mentees have worked with is not their changes, it's how to let their changes be okay to everybody else. The family dinner, the Friday night happy hour, the girls' night out, the guys watching the game. I'm just making stereotypes, of course. But this is where it becomes hard. It gets hard when it interacts with other people. Because if you were on an island and had one of those Star Trek machines that will replicate any food you want, you just eat what you wanted and what you needed. You could have a perfectly healthy relationship with food and fitness and body image. You put one more person on the island, all of a sudden now it's about that person too. What are they eating? What do they think I'm eating? Should I be eating what they're eating? What do they think about what I'm eating? Oh, well, we're supposed to be eating together. Oh, I thought you were eating this. Oh, it's breakfast, lunch, or dinner time. I thought we were going to eat coconut. No, I thought we were having fish. I mean, oh, I don't want more fish, but I bought all these, but I hunted and got all these fish frozen. Yeah, but I want more coconut. What are we going to do with all this fish then? I mean, it's just right? It just instantaneously becomes logarithmically more complicated, right? It's like chaos theory in life. And instantaneously, we're in a more challenging environmental setting around food. So it's inherently emotional. Food is inherently emotional. And then you add the complexity of social interaction and cultural environment. And the complexity just goes up and up and up and up and up. And if we don't help our clients address and empower them with how to negotiate their way through a complex world, of psychosocial, spiritual, emotional, energetic forces at play when it comes to eating, we should never be surprised that they're not following our logistical, science-based, very well researched, practical programming and advice.
Okay, I'm going to pause you because we have a question
Great,
that goes along with this. First off,
great.
maybe it's a quick answer, maybe not, but doesn't it take around 10 days to stop some nutritional addictions like sugar or caffeine? Or do we have a date range for that?
I am not confident in saying that there's a date range for that, and I'll tell you why. You might be able to shift your biophysiology in 10 days. Like you might be able to get your dopamine receptors to reset or your taste buds to reset. I don't even know if that's true. I suppose it's possible, but it takes a lot longer to reset your relationship with whatever food it is that you find yourself addicted to. So,
Understandable.
a quick sidebar.
Quick sidebar. And then still along those lines, but what are a few examples of simple real life nutrition habits that we or can offer that respect the client's reality, like food access, family dynamics, peer influence, while still supporting their energy and choices?
Well, that's the job. I mean, I don't mean to be brutally rude, but like that is the challenge. And so I can give some practical advice here in a couple of minutes. But what I wanted to offer was a quick sidebar about this, and then we'll come back to that question and I'll unpack it some more. Whether it's GLP-1s, whether it's bypass, whether it's the sleeve, whether it was fen-phen, it doesn't matter what system someone uses to find a way to restrict their caloric intake, lead to weight loss, create some sort of change in their lives. If they don't do the food relationship work, then wherever they end up, they're still there. And we see this over and over again in our industry. People do all these dramatic programs. They go on, hardcore workout programs, supplementation, exercise, diet, et cetera, et cetera. They get down a certain amount of weight. And the problem is they go right back to their old ways because they never resolved their relationship with food. They never resolved these complex issues that you're bringing up, Nicole, that the participant is asking about. Like, well, what about food access? What about family? What about money? What about time? Well, we never addressed those issues. We just used whatever tool was available to us. And now without that tool, we're back to our old ways. So we have to address this work with our clients so that we can help them build a realistic, sustainable, long-term approach to food that can handle and weather the natural ups and downs and challenges of life.
Okay, so speaking of challenges of life, um, what's your experience with navigating the economics, politics of food in the light of rising prices, the lack of quality food, and the affordability of highly processed foods? How do
Okay.
you push against it?
Yeah, so really, I want to stay focused on individual mental health. That's much more of an anthropological, social, political conversation. That's hard because we only have so much influence over those forces. We don't have we can't make. It's not up to you and me to decide that eggs are going to be cheaper or more expensive. That's up to forces way above our pay grade. But what we have to find a way to do is empower our clients to be savvy and strategic and resilient and gritty enough to figure out a way to address the circumstances that they find themselves in. Now, if some of that includes political activism, if some of that includes social activism, great. I'm happy for them to do that. But if they live in a food desert, our first and foremost issue is to help them figure out a way to get access to food, right? They can rail against the political system. They can want to change the agricultural food marketing system. Yes, that's great, but that's not going to make eggs any cheaper for them if they're on a high protein diet and eggs are what's available or what they need to be eating and they can't get them or they can't afford them. We need to help them figure out that system. And so that's where the logistical side of our work comes into play. We have to understand the psychosocial environmental dynamics, right? The social drivers of health. We can't just say, we got to just eat more eggs. Eggs are really good for you. Well, yeah. How am I supposed to get eggs? I can't find them. I can't get there. I can't drive there. They're super expensive. They're not available. And if we just say to them, we'll just keep working on it without the psychosocial logistical support, we shouldn't be surprised that they're not going to succeed. Or if we just say to them, well, instead of eating eggs, just have more chicken. And they're like, you're not really helping me by just telling me to swap out eggs for chicken. It's the same problem. You're not actually helping me with the problem that's here. The problem is usually logistical and psycho-emotional, social, psychosocial, emotional. So we have to work on both sides because otherwise their mental health is going to be trashed along the way. If we just say keep, pulling yourself up by your bootstraps, or just recommit, or just be more dedicated, or just buckle down, or just pull yourself up by your bootstraps, when we have a tendency to in America to do this to people, or we just throw more data at them and then we're surprised when they can't use the other data that we've given them. It's like more data doesn't get me anywhere. I understand I need to eat a high protein diet. I understand that I need to avoid processed foods. Great. Come live my life for a minute and help me figure out how to make this work. But too many practitioners in our field haven't been given the exposure to social drivers of health. They don't understand food justice. They don't understand food equity. They don't understand food psychology. So they're limited in what they can offer people. And our program does our best to give you a wide range of understanding of the complexity of helping clients change what they eat from all of these arenas so you can impact and have an influence on those situations.
Yeah, and there's a comment that's been in here for a moment, going back to weight loss, since that is something that a lot of people are looking for too,
Yeah,
that has to do with more than calories, right?
right.
There's sleep that affects cortisol levels that can affect weight gain. So, looking at this, can it be achieved by looking at different aspects of modifiable lifestyle factors? Like this would take listening to the whole story of the patient and client and going from there. And that includes some of that mental health work too, right?
Yeah, it's all I I'm biased. I think it's always about that. Okay, you can teach someone every logistical thing you can. You could hand them reams of paper about food banks and about, cooking ideas and about fast, easy meals with 5 ingredients that you can get from the food bank. And I mean, you can give them every bit of data that they could ever possibly need. But if you don't support them psychosocially, spiritually, emotionally, energetically, psychologically, they may not be able to use what you've given them. This is the number one problem I see in our industry. People are overeducated and underempowered. Now, that doesn't mean that we shouldn't be educating people. Obviously, people have a big gap in knowledge, but a lot of the gap in knowledge is not what to eat, it's how do I get this into my life? How do I actually fit this in? How do I negotiate all of these external challenges that I don't have a whole lot of influence over, right? And it's some of it is nuanced. Some of it is nuanced. It's depending on your demographic, depending on the clientele. A client might be like, "Oh, I didn't know that corn and peas don't count as a vegetable. I thought they were vegetables." Well, you're like, "Yes, they are a vegetable, but they're a starchy vegetable. But are they a good starchy vegetable?" Like you can get into all kinds of nuance. But you have other people who are just like, I don't know what protein, carbs, and fats are. Like, I was never taught this. I don't know anything about it. I dropped out of school in eighth grade. I've never been given any nutrition education of any kind. I've avoided doctors for 30, 40 years. I've, been in the system. I've never had a job that paid money and had a paycheck, never had insurance. All of a sudden, I've got benefits and I'm being told I've got multiple conditions and I need to see a nutritionist to get my health under control. It's the first time in my entire life. I'm 50 years old. Never thought about nutrition in my entire life. I know nothing. Well, yeah, that person's going to need a pretty big Nutrition 101 lesson over time, combined with how do we help you put this into action into a life that's pretty well established? And I can't just say, oh, we'll just change that. We'll just get up earlier. We'll just leave work earlier. We'll just take a break at work. Like, well, I can't do that. Oh, well, maybe we need to work on that, figuring out a way around that. Well, there's nothing I can do. I work a 12-hour shift. Okay, you work a 12-hour shift. Guess we have to figure out how to help you be as healthy as possible when you can't take a break in a 12-hour shift. It's just the reality of life. And when we steer into that, we are not only benefiting their health and physical health and wellness, but we're helping their mental health and wellness because instead of them feeling like, but they should be taking a break, but they know they can't, but we've said, but just find a way, or tell your boss that you're going to, or um, just make it happen and stand up for yourself. Like, maybe you can, but maybe that's just not a realistic option for somebody. And we have to work with what's real for them. So we both have to push the limits where we can and accept the limits as well. It's always a double-edged sword, if that makes sense. Um, I keep coming back to the serenity prayer. We only have so much influence, we only have control over so many things, and knowing the difference is helpful. And often practitioners are trying so hard to control every little component of the client's life And the client's like, look, I can't do that. Like, but if you don't do that, you're just not going to get better. If you don't drink more water, if you don't stop drinking coffee, if you don't take your vitamins, if you don't exercise, if you don't sleep more hours. And they're like, that's just not going to fit into my life. So it becomes a negotiation. Coaching is always about a relationship. And we talk back and forth and back and forth, and we negotiate with the patient. Well, what is realistic? How can we help you? What can we help you do? You have this idealized plan for me. Well, all right, how close can we come to this idealized plan? What can we implement? What can we change? What can't we change? What's a non negotiable for you as a practitioner? What's non negotiable for them? And all of this can reduce the mental, emotional, and cognitive load that our patients are carrying, which ups the chances of them being successful. I'll pause. I feel like I'm on a run.
Yes. So steering into that, what can we do? Is that these discussions? Is that
That's literally what you do. You just
steering
say,
into it? Yeah.
yep, you literally say, tell me more about that. Let's talk about that. So often in our industry, we've been told, well, you can't talk about emotions, and that's the realm of psychotherapy, and you're just here to educate, or you're just here to tell them what to do. I don't think so. I don't think so. I think to be truly effective, we have to be able to do both. And yes, certainly, if a client comes in and says, I have cancer, I have PCOS, I have diabetes, what am I supposed to do? How am I supposed to eat? Yes, yes, of course. I will happily talk to you about some suggestions and advice on what you should eat. But if we don't talk about all the rest, how are we going to help you actually implement it?
So this is kind of a question that goes into that, specifically in the programming that you do in the classes that we have, or at NUNM. Would students be taught change psychology and or habit-based change?
That's what I teach in their food relationship coaching 101 class. Yes.
Fantastic.
And that gets applied in numerous classes. It gets reinforced in numerous classes. It gets reinforced in your clinical rotation.
Mhm.
Yes, that's what we're all about. So we are teaching you everything you need to know to be the best diagnostician, the best nutrition programmer, the best, scientist, researcher, analyst, statistical analyst. Like you will be a hardcore scientist. You will know everything you need to know about nutrition or how to study it, how to learn it, how to be a lifelong student to understand research studies and how to understand labs and how to understand food as medicine and biochemistry and neurobiology. I mean, you will be dialed in on that stuff. And you will also understand the human side because we teach classes like cultural humility and nutrition and psychology and food relationship coaching. And we do also another component, which is you will also be able to help your clients in a very hands on way because we have teaching classes and we have classes that take you to farm to table and teach you how to actually make food, teach how to cook. We have teaching pedagogy. You have to be able to do all of this work. You can't just have a client come in, they tell you what's wrong, you print up a huge menu and a huge meal plan, you hand them the meal plan, you say, great, go do this. That's what the industry has done traditionally, and that's not what we're teaching. We're teaching you how to engage with a whole human being with all the complexities that they have, and we give you all of the skills and knowledge of how to facilitate change in their lives in the biggest way possible.
So with facilitating that change, is it helpful to tell clients, like, use me as an excuse? Tell your boss, my doctor says I need to drink more water, as an example.
I mean, that's where it gets tricky, right? It's always tricky when it gets to the rubber hitting the road. In some cases, it is just supporting our clients to feel confident and comfortable, and giving them the confidence to go and have that hard conversation. Sometimes that's all it takes. The boss would be perfectly receptive if they asked, but they don't ask. They're shy. They're nervous. They put themselves last. They don't want to make waves. They don't want to ask for special favors. Maybe our job is just to help them feel more comfortable and confident going and asking. But then the boss is like, bite me. You can't have a break. Do your job. Nobody else complains about this stuff. Suck it up and deal with it. Okay, well now we're talking about something different. Now we have to help the client either resolve that challenge, which is, okay, well, I'm not going to be able to take a break. I'm not going to be able to drink water in the middle of my day. What do we do instead? And you, as the practitioner, have to help kind of figure that out. Well, maybe they just drink water before work and after work. Maybe you have them eat foods that are high in water. We just have to figure it out and strategize it. And maybe there's a conversation that comes up with the client that says, you know what, Ian? You know what, Cindy? You know what, Nicole? I've been so sick of this job for so long, and they won't even let me get a damn drink of water on a 12-hour shift. F this job. I'm out of here. That is the push that I needed to finally make a change in my life. Because I'll tell you something, when you work with clients on their relationship with food, it is a pebble in a pond, and it will have impacts on every dimension of their lives. Because when you're actually working on relationship with food, you're working with the client's relationship with themselves. And if you empower them to make better choices around food and to stand in their own strength and to say, this is what I need, bang, they're going to start asking other people in their lives to do better and give them more what they need and want for their lives. Their partner, their kids, their job, their politicians, their community. The reason this work for me is so powerful is not because I help people make dietary change. Yes, whoop-de-doo, they lost some weight, they're a little healthier, they got their diabetes under control. I'm tickled. I'm thrilled for them. Obviously, I'm perfectly happy for them. But you know what I love? Is that that person turns into a badass. And oh my gosh, and I've noticed that my relationships have gotten better because I don't let anybody run me over, either A, telling me you have to eat this, nor are they telling me you have to do any of this, XYZ. I had a client the other day, my favorite client right now. She's like, Ian, I've realized I've been eating everything people have been putting in front of me, literally and metaphorically. And she's like, as much as our work has been about me changing my diet, it's about me not eating any crap from anybody that they give to me. That's the work that makes me excited. That's why I do this work, is because I see people have positive change in the rest of their lives. And if that ain't mental health, if that's not an improvement in mental health, confidence, self care, self respect, self reliance, standing on their own 2 feet, getting out of a negative mindset, believing in themselves, can do attitude, stop shooting on themselves, that's the real work that we have an opportunity to do through the lens of nutrition, through the entrance of helping a client with eating better, exercising better, sleeping better.
Absolutely. So we might be veering topics here a little bit, but we have in the chat had food intolerances brought up a few times. Can you touch on this and how we can manage that as well?
I sound like a broken record and I don't mean to be a jerk, but it's the same thing. You just have to talk about it. What are the food intolerances? How do you know you have food intolerances? Have you been tested for food intolerances? What are those food intolerances? How do they impact your life? What have you done to change them in the past? What are the challenges with making the changes that you need to make right now? How can I empower you to make the changes? What's getting in the way of those things? What support do you need? What hurdles are in the way? It's the same conversation. It doesn't matter what the topic is. It's a coaching conversation. It's a relationship with conversation. So whether it's a relationship with food desert, food intolerance, picky eater, too busy at work to eat, it's the relationship to that topic that you have to talk about. And that's what opens you up to psychology of change, behavior change management, habit formation, positive psychology. There it is. Doesn't matter what the topic is. And I think that might be something that is a sort of cultural artifice that we've all been given, which is that somehow it should be different. Well, that's a different topic. No, it isn't. It's the same issue. The client's relationship with figuring out their food intolerances or living within what they know about food intolerances isn't working. Whatever part of that story ain't working for them is what we have to help them work on. Now, that could be psychological, emotional, it could be cultural, it could be societal, it could be environmental, it could be their job, it could be their spouse, it could be their household, it could be lack of money, whatever it is, that's what we have to help them work on and figure it out. And our job is to help them understand what the issue is, help them grapple with that issue, and then help empower them with whatever skills or knowledge or support that they need to go out there and do their best on a week-to-week basis to have a positive impact on it. And what's interesting is that often it's not the topic, it's something underneath. It could be trauma, it could be self-confidence, it could be emotional regulation, it could be mental health. A lot of the work we do has nothing to do with food, but everything we do impacts the client's ability to eat the way they want to eat. So it is about food, but often indirectly. Is everybody following my train of thought here? It's not all about telling people another swap. It's not about writing them up another menu plan, another shopping list. Like those things can be helpful. I'm not saying they can't be helpful, but is that what's really the most effective tool? Usually it's not. Usually it's, why aren't you following your menu plan? Why aren't you able to buy the foods that we've put on your shopping list? Why aren't you eating the foods that you've said you'll work on eating more of these foods and less of those foods? Oh, well, time, money, energy, effort, kids, job, dog, availability, time, money, whatever it is. Great. Let's talk about it. No judgment. Just great. Let's talk about that then. Oh, I didn't realize we were going to talk about feelings and thoughts and yeah, let's do it. Because food is so emotional. It is so much about the mental, emotional, psychological relationship that people have with food. It isn't always about the logistics, but they interact with each other. If you're not mentally, emotionally, psychologically feeling solid or capable of the logistical asks from your nutritionist, your naturopath, well, then you're not going to feel so great about yourself and you're not going to be successful. So why should we steer? Let's just steer into that and talk more about that. And that's what I'm teaching in this class. That's what some of our other practitioners, some of the other teachers are teaching us like, yes, good, talk about that too. Talk about all of it. It's not instead of, it's always both and.
Hmm. Yeah, we have a comment in the chat, and to summarize quickly, it's the why behind it.
It's always the why. Yeah. To get cheesy and simplified, it's always the why. Yeah. And it's kind of cheesy and corny, right? I teach my students, um, for all intents and purposes, ask why 3 times. It's not literally ask why, not like a 3-year-old, right? But ask why 3 times. Well, why is that? Tell me more about that. Because if you don't ask the question 3 times or ask a similar related question 3 times, if you don't get 3 layers down, you're not getting to the real issue. Oh, I'm just too busy. Why are you too busy? Well, it's because I work a full-time job. Okay, tell me more about that. Well, by the time I get home, it's already 7 o'clock and I'm just too tired to cook. Okay, tell me more about that. Well, by the time I get home, it's 7 o'clock and the kids, they're doing their homework and my husband's watching TV and I'm just not in the mood to make a meal. Okay, that's very different than, oh, I'm just lazy and I'm unmotivated. There's a bunch of issues going on here that we could maybe talk about. Have you talked to your spouse about this? Well, no. Have you talked to your kids about this? Well, no. So what's going on? Well, they all want this or they want that, me to cook this or that or the other thing. Okay, well, what do you want to cook? Well, I want to cook healthy and they want me to, order a pizza or make enchiladas or whatever. Okay, well, have you had a conversation with your family about this? Well, no. Was this about motivation or is this about the fact that you haven't actually had a conversation about the logistics of feeding the family at night and the fact that you're exhausted when you get home from work? And oh, I don't know, maybe your spouse could get up off of the couch from watching TV and help, or I don't know, you've got 14-year-old and a 10-year-old, they're perfectly capable of helping in the kitchen. Is that something you've ever thought of? Well, yeah, but they want to play their video games. Okay. This is your choice, right? You can let them play video games or you can ask them to help out with dinner. Oh, I guess I could ask them to help out with dinner. They can play video games after dinner. It's not about motivation necessarily. It's about, I have never thought of it this way, Ian. Why hasn't anyone ever asked me these questions? Instead, what people say is, well, why don't you just make a crock pot meal before you leave for work? Or why don't you take out a frozen piece of meat and put it in the fridge beforehand? Or, why don't you work on Sunday and batch cook a whole bunch of food and make it ahead of time? Like, well, okay, yeah, maybe those will help. But if we never address the underlying frustration and the feeling of I'm on my own and no one's supporting me and I'm the only one who wants to eat healthy in this family, I don't know that that person's necessarily going to use those tools, good as they may be, to help them be successful.
Okay. I'm thinking what we should do now is I want to give people an opportunity to speak up or turn their cameras on if they want without being recorded. So I'm going to go ahead and
Sure.
end the recording now. And with these last 15 minutes or so, I would love to give people the opportunity.